Hi everyone! During one of our All4Cure team meetings, we came across the topic of ClonoSEQ testing when reviewing MM1130's dashboard. We wanted to tell you guys more about what ClonoSEQ testing is in this video. Your body's immune system is made up of many different parts. It includes B cells, T cells, and immunoglobulins. Let's zoom in to one of these B cells. If you take a closer look at the DNA, you'll notice that each of the sequences is different depending on the B cell that you're looking at. Because of this, you'll find a wide variety of B cells at very low quantities. ClonoSEQ looks at the different sequences of the cells so it can differentiate the different types of B cells. Multiple myeloma patients have abnormal B cells that proliferate when they're not supposed to. ClonoSEQ can look at the sequence of those B cells and quantitatively keep track of the number of cells in a patient's body. It's so specific that it can find one abnormal cell in a million normal cells. ClonoSEQ testing may help you have a better understanding of your disease.
So I think Cheng's question about is she MRD negative using the most sensitive testing, they would have done in this clinical trial, they will have done some pretty sensitive MRD testing. I'm almost certain they would have done ClonoSEQ as part of the clinical trial.
Is ClonoSEQ next generation sequencing? Are those the same thing?
Yeah. It's next generation sequencing is a broad term that, describes massively parallel sequencing, and there's many different applications of that. ClonoSEQ is a clever implementation of that, where the next generation sequencing is focused on regions of the genome that are associated with rearrangements that occur in immune responses, either B cell responses or IgG gene rearrangements, immunoglobulin locus gene rearrangements, T cell receptor gene rearrangements, and ClonoSEQ and variations of ClonoSEQ can deeply sequence only those regions of the genome that are involved in these rearrangements. So it's a very focused approach for next generation sequencing that allows you to characterize very deeply what the entire repertoire, for example, of the B cell population in a person looks like. And so for a person that, healthy, doesn't have myeloma or any other cancer, and isn't fighting an infection, you'll see a very broad repertoire of immunoglobulin gene rearrangements. It's like everybody will have, a small numbers of very many different rearrangements, because each of those rearrangements is designed to create an antibody with a very specific specificity to a given infectious agent, say. And so if we have normal immune systems and we've been exposed to things and have been vaccinated over time, we have this huge reserve of B cell clones present at very low levels that are ready to attack any sort of infectious disease that we might come across, by expanding, making antibodies specific to that infectious agent, and then it goes down, goes away. If you have myeloma, of course, you have a B cell now that is not expanding normally in response to an infection. It's expanding because it's involved with a malignancy. And now that gene rearrangement, that specific region of the genome of that, and that specific sequence of that abnormal B cell can be tracked quantitatively. So you can say, okay, that B cell is present at a much higher level than the millions of other B cells with different specificities, and that allows you. And so ClonoSEQ can track that with a super high degree of sensitivity. So ClonoSEQ is more sensitive than flow by and large. ClonoSEQ is a standard molecular assay that can be applied to anyone and has that level of sensitivity of one in a million.
How much does it cost to get ClonoSEQ testing?
It's not cheap. It's like $3,000. But that's one dose of Ninlaro. It's one pill of Ninlaro. So it's, so it's not cheap, but if you compare it to the cost of the treatment, it's way less than the cost of the treatment.